This is John. He's 55 and he suffers from multiple sclerosis. And he's going to tell you a little bit more about the disease. Hello, John.
Hi. In 2016, multiple sclerosis affected about 2.3 million people globally. The disease typically affects women twice as much as men between the ages of 20 and 40. According to Weiner, populations of European ancestry is 1 in 1,000 more likely to have multiple sclerosis compared to non-European populations, such as African American and Asian ancestry. This is because genetic factors influence the immune system, which can permit MS. Non-European populations may not be affected because of their genetics, but their geographical location can increase their probability of an environmental factor triggering MS, as seen in Figure 2. Not on here. Populations with increased sunlight exposure can have a higher probability to develop multiple sclerosis. On the other hand, a person with MS can have different treatments, such as medications and physical therapy, to help slow down the progression, but it can't cure them. The individual would have to pay for the medications, therapy, and hospital stays depending on how often they relapse. Noyes 2011 states that the cost can add up to 50% of an individual's yearly costs for 10 years without insurance coverage. Unfortunately, the expenses to treat MS are extremely high, which cause some patients to be unable to receive the proper treatments. Alrighty, everyone, have a good day.
Most people are diagnosed with multiple sclerosis between ages 20 and 50. According to Connie Bridgeford, after 50, the symptoms of MS seem to overlap with symptoms of aging. This could include muscle weakness, balance problems, fatigue, visual changes, cognitive impairment, and even sleep disturbances. Movement coordination is lost because messages from the brain cannot travel down to the muscles to cause contraction due to damage in the myelin sheaths. This causes a loss of motor control and even spasticity and an overall delay in motor skills.
Although there is no way to prevent MS, research shows that there are a few ways to decrease the likelihood of developing it. A study by Coriel reported that high levels of circulating vitamin D have been associated with a lower risk of MS, and higher serum 25-hydroxy-vitamin D levels correlated with fewer MRI lesions and relapses. In another study by Barnham regarding fish oil intake and MS suggests that intake of fatty fish may be associated with a decreased level of multiple sclerosis. There are many ways to rehabilitate this complex disease. Regarding physical rehabilitation, endurance and resistance training of moderate intensity show positive effects on muscle strength, condition, functional capacity, balance, fatigue, and quality of life. Physical therapy is used to prevent muscular atrophy, increase mobility, maintain posture, and decrease pain. Multiple sclerosis patients can often suffer social consequences, so cognitive rehabilitation is used to enhance memory, concentration, processing, and speaking. Cognitive rehabilitation focuses on two main strategies or approaches: the restorative approach, which depends on the possibility that the brain is capable of cortical reorganization following inquiry, and the compensatory approach, modifying the patient's environment.